and welcome to another episode of Ask the Doc. I am your host, Jennifer Filzen, and today I have with me Dr. Arthur Jenkins of Jenkins NeuroSpine. Welcome, Doctor.
Hi, it's great to be here. Thank you very much for having me.
I'm so happy you're here with me. Listen, I want to hear all about you and what you are doing in the world as a neurosurgeon. So tell me a bit about NeuroSpine and how you got started.
I've always, since I was 16 years old, wanted to be a neurosurgeon. I went to medical school because it was a checkbox to become a neurosurgeon. I went to college because I thought, well, maybe one of the coolest ways to learn about where thought comes from, how nerves process information, would be to take cells apart at the subcellular level and be a biochemistry major. So I did that, and then I went to medical school, Penn Med. Did my residency training at Mount Sinai in New York after an internship at NYU. Went and did a fellowship up at the Brigham in Boston, and then came back and worked as 17 years as a full-time faculty member at the Icahn School of Medicine at Mount Sinai, doing academic spine research. And then about five and a half years ago, I went into private practice, where I get to call all the shots.
I love your journey. Oh my gosh, thank you for taking us on your journey. That is so amazing. And gosh, I didn't know what I wanted to be when I grew up. I'll tell you, when I was little, I thought I was going to be a nurse, and then I saw blood. I'm like, nope, that's not going to be it. So I applaud the fact that you had your vision and that you continued going, and here you are, private practice, calling the shots. That is amazing. Good for you. So I'm always fascinated by the actual business that you're doing. So NeuroSpine. Okay, we all know that the spinal column has all of the nerves in there, right? And that's why we go and get a chiropractic adjustment so we don't have subluxations on those nerves. But tell me a bit about the last iteration of the 5 years. What is it that you're doing? Who are you serving? And if you don't mind, share us some success stories from your treatment.
Well, so there are 24 vertebral bodies in the average person. There's more than that between the pelvis and the sacrum and the skull. Each one of those levels has 3 or so separate joints, making the spine really the most complicated joint in the entire body. And then you have all these different paired nerves that come out at each level that provide all the sensation and motor function to our entire body. And the complexity there is part of what I enjoy. I do the entire spectrum of spine, from Chiari's and craniocervical instability all the way down to coccygectomies. And one of the great things about being on your own and being your own boss is that I still do research, and I love doing research. And to me, research is a commitment to doing what we're doing, but every day trying to do it a little bit better. And so I have a research team. I run research summer internships. Every day I'm trying to figure out, how can I do it better? How can we do it with less impact on the patient, but still get the same goals that we set for our patients? How do I, essentially, as my practice trademark is, we turn patients back into people, but how can I do that with the least intervention and the most effective intervention?
I love that mantra. We turn patients back into people. Because, it's interesting, isn't it? When you're in pain, everything starts suffering, right? When you're in pain all the time, your mood goes down, your mental health goes down, your productivity goes down, your relationships start to decline. It's not fun. And so you are doing what you can to help people be themselves again. And that's outstanding. I love your innovations. I also understand that you have worked with the New York Jets and the New York Police Department and other groups with your expertise. Tell us a little bit about that journey.
Yeah, so about 20 years ago, when I was first in practice, actually, I was tagged by the NYPD to be one of the people they call when they need help. I've always thought of it as the metaphor. The NYPD will say, The average citizen calls 911, but who does the police department call? They call what their ESU, their emergency services unit, when they need help.
Nice.
And so who does the NYPD call? I'm one of their elite crew of doctors and surgeons that they call when they need help, and they don't want you volunteering to be one of them. They'll choose you. So if they choose you, they've done their due diligence, they've vetted you, and they've said that's who we want. Same thing with the NFL and the NFL teams. And so I take call every time the Jets are at home, and we cover both teams. That's how the NFL works. The home team covers both teams, and so if there's an emergency on the field that requires a neurosurgeon or a spine surgeon to evaluate, I don't get to go to the games. They want me ready to meet them at the hospital when the ambulance lands across the street.
I was going to ask because right there on the
no such luck. But it's the bottom line is you got to stay up on all of the latest trauma and activity. Like what are the latest treatments on everything? And so it's I enjoy the challenge, but it's also it's nice to be able to give back and make sure these guys are doing what they do.
Well, outstanding, doctor. Truly, you are a delight. I'm so happy to know you and that you are doing such good work for people. Thank you. And everybody, thanks so much for tuning in. I really appreciate you joining us today on Ask the Doc. And if you would like to learn more about Dr. Arthur Jenkins and what he's doing over at Jenkins NeuroSpine, please go to BuzzTV at iwannabuzz.com. Okay, until next time, see you later. Bye.